Hi, Mr. Flapjack.
Hi, yes.
Nice to meet you. I'm Dr. Pattison.
Nice to meet you.
Hi, Dr. Finity.
Nice to meet you.
Dr. Hackney.
Good heavens. Nice to meet you.
Thanks for coming, Mr. Flapjack. I'm Dr. Hughes.
Nice to meet you.
I'm Dr. Knudsen.
Doctor. Wow, we got the whole gang here.
We do.
This isn't going to be 5 times the price, right?
Maybe.
Okay.
Do you mind if we take notes during this?
Oh, by all means, go ahead.
Okay. So, what brings you in here today?
Well, my cat Chicken Wing here hasn't been feeling real well for the past 3 or so days. Been throwing up a lot, and this morning he really didn't eat a whole lot, so kind of needed to have him checked out and see what's going on.
Okay. Well, you came to the right place. So, can you describe what the vomit looks like?
Well, initially, there was like chunks of food in it, but like it's become a lot more just fluid lately.
Okay. What would the frequency be, do you think?
I have no idea really. Because I don't think that I see them all because our dog, Nutella, kind of
helps clean up?
Yeah, unfortunately. Yeah. So, which is kind of a good and bad thing, I guess, but,
sure.
But you know, he seems okay.
Okay. Well, if you don't mind, I'm going to pass it to Dr. Finity so she can ask some general history questions.
Okay.
So, how long have you had Chicken Wing?
About a month now.
Okay, and where did you get him?
From the shelter.
Which shelter was that?
It's the one over on North.
Okay, great. And do you know much about his history? Did they tell you anything?
No, really. He just needed a home and kind of had that sparkle in his eyes, so.
Perfect. Well, it seems like he found a good home. So
I
congratulations.
hope so.
Good. And do you know, did they tell you anything about his vaccination record?
His vaccines, I think, were completely up to date.
Good. Okay. What about deworming?
Yeah, I don't remember saying anything about that. Dr. Hughes, is that something that they commonly do in a shelter?
Typically it is. Usually it's like a yellow liquid substance they just give them orally. Takes care of all their intestinal parasites.
Yeah. So I don't know, maybe they did that, but I didn't hear anything about it.
We can look into that.
Okay.
That's fine. And what do you normally feed Chicken Wing?
He's on the Purina Indoor.
As you go into that first client meeting, be prepared to ask questions about the presenting complaint, as well as your patient's general history and lifestyle. Be thorough during this initial interview. If you don't get all of the info that you can, you might miss an important piece to your case. And don't worry, it is okay to take notes during this session.
Okay, I'm going to turn you over to Dr. Hackney, who's going to perform a thorough physical exam on Chicken Wing.
Okay, great.
And if you don't mind, I'm just going to help her out by hanging on to Chicken Wing just in case he decides to get cranky and move away.
Okay.
So I'm just going to listen to heart and lungs, make sure everything's normal. We'll save the temperature until the end so he doesn't get too mad.
Okay.
So looking at his eyes, making sure there's no discharge.
His eyes look clear. I don't see any discharge.
Making sure his ears look okay.
They look great, nice and clean.
Checking out his nose, making sure there's no discharge.
I don't see any discharge.
I'm going to run my hands along his back, looking for a skin tint.
Does that hurt when she pinches like that?
That's a great question, but there's a lot of loose skin there, and it's just a great gauge to help us assess hydration status.
Oh, okay.
His skin turgor seems a little slow. You know, I think he's a little bit dehydrated, maybe 5%.
And then before I listen to his lungs, checking out his abdomen, making sure there's no organ changes or pain.
He doesn't like that. I think he's got some significant abdominal pain. He's very tense and painful.
Okay. Real quick. Listening to his heart rate and his heart sounds.
His heart rate's about 110 beats per minute. His sounds are normal. I don't hear any murmurs or any arrhythmias.
Listening for his respiratory rate and also his lung sounds.
As you conduct the physical exam findings will be provided to you by your facilitator. But if you don't verbalize what you are examining, the facilitator will not give you the findings. Consider communicating your findings with the client as you go. And don't forget to conduct a complete head-to-tail exam.
All right, well, we're done with our physical exam.
Okay.
So what we're going to do is we're going to talk about the physical exam results. We're going to go over the history, everything that you've told us. We're going to come up with a plan outside of the room so you guys can sitting here for just a couple minutes. If you think of any questions for us during that time, you can ask us when we come back in, and we should have a plan for you at that time.
Okay, great. Thank you.
Thank you.
Thank you. Get your bag.
Okay, so we just met Chicken Wing. He's a 3-year-old neutered male, domestic, short hair, and he came in today for a 3-day history of vomiting and increasing in appetence that led to anorexia this morning. Physical exam seemed pretty normal except for a skin tint that we thought was about 5% dehydration and some abdominal pain, but that's about it.
Okay. So what are you guys thinking?
I think we'd like to take some radiographs.
Okay, how come?
I think that would help us localize the abdominal pain better.
Okay. What else are you thinking?
I would like to get a CDC Kim. He's a new patient. We've never seen him before. And a vomiting cat, that's a pretty broad problem. I'm hoping maybe we think a CDC Kim could maybe start to narrow that.
All right.
I'd like to get a fecal. The client doesn't know the history of deworming, and sometimes a large parasite load can also cause vomiting. So again, trying to localize or rule out any internal parasites that we can find.
That makes sense, easy to do.
Mm-hmm. I also think it's important that we start treating some of his immediate problems, like the dehydration. So maybe place a catheter and start some fluids.
Sounds good.
After the physical exam, take a time out to discuss the findings with your group and design a diagnostic plan. During this meeting, your facilitator will be present, so use this as an opportunity to conduct a mini round session. You can use the case presentation format that you used in SysPath Lab. When presenting your plan to the client, make sure that you can clearly explain how each diagnostic test, procedure, and/or treatment will benefit your patient. Your client may not approve every part of your plan during this first meeting, but don't worry. You'll have other opportunities to request additional tests.
Hi, Mr. Flapjack. Thank you for being patient.
So what did we find out?
Alright, so we've been discussing what we think is best for Chicken Wing moving forward,
Okay.
and we have a plan that we would like to present to you.
Alright.
Alright?
Sure.
First of all, we would like to start with some IV fluids, just because we said he was dehydrated, remember the skin tint?
Right.
So we want to correct that as soon as possible,
Okay.
to just help him feel a little bit better.
Okay.
The next thing we'd like to do is some abdominal radiographs.
Now, why do you want to take radiographs?
That's a really good question. There are a lot of different things that can be causing pain in the abdomen, and radiographs will help us either determine what it is or help us rule things out so that we have a better idea going forward.
And it's important to know that a radiograph isn't always the most sensitive, so it's possible that it won't tell us anything, but at least then we'll know that there isn't something absolutely majorly wrong with Chicken Wing that needs to be addressed right away that's an emergency.
Okay.
And then the last two things we'd like to start with are a fecal. Since we don't know his history, we asked you about deworming,
Right.
help us tell us about intestinal parasites, and then a blood work panel, some CBC and Kim.
Okay. So that seems like a lot of items there. Is this going to be very expensive?
Your client will want to know how much your diagnostic and treatment plan will cost, so be prepared. Bring price lists with you to the initial interview and be ready to answer their questions regarding costs.